stage renal failure,
Mm.
what are your options?
Yeah. Okay. So I suppose ideally you're in the stages before end stage. So ideally, we like to see patients earlier so you can get them on the right journey, the journey that's right for them. So we sort of if you are aware of the stages of kidney disease, around stage 4, when your kidney function's less than 30 and dropping, you start having those discussions about what your options are. So basically, there are 3 options. Get a kidney transplant and get it preemptively. So that means you just go straight from as your kidney function drops, you get a new kidney and your kidney function goes back up again. That is ideally the best, but it requires the luxury of having a living donor available kind of heads up. Not everybody has that luxury. Then the next option is dialysis. That usually people start when their kidney function's getting low, significantly low. So at the levels of maybe, 10% and dropping, starting to get symptoms, then that's the stage when they may need to start dialysis. If a patient is starting dialysis, they're not excluded from transplant. If they're fit and able to be on the transplant list, that conversation should be happening concurrently, and that you should be being worked up for a transplant and get yourself ready to be on the wait list. So when you start dialysis, you're on the deceased donor waiting list, and then wait for a deceased donor to come available. And the third option is when a patient decides that they want neither of that. So they don't want to go on dialysis and they don't want to be transplanted, and often not fit for transplant, and they may choose supportive care. And that tends to be our older population, sort of in their 70s and 80s, probably more in their 80s, who decided that we want to go the route of intervention. And there's a whole program that manages that.